are they really going to trust me? The Holy Spirit is there. We each have him in our hearts, and he has promised to help. So he fills in the gap where you fall short, and you will get a second chance. There will be another opportunity, especially if this is someone that you see on a regular basis.
That's what I was going to ask. If you're witnessing somebody and you're never going to see them again, you're traveling 100 miles away from the house, 1,000 miles an hour, and this is your last chance to see them, give them the gospel, give them scripture, give them tracts, give them literature, give them a way to contact you. If you're taught as somebody you're going to see every day or frequently or more often, then you don't have the pressure to get everything out in the first visit. Talk to them, befriend them, build a relationship with them, but be intentional. It's not just to make a friend, it's to make a disciple. So,
and that word intentional is a great word, because the reality is that if I am intentional, then God will show up in a big-time way. Whereas otherwise, I'll just be leaning on my own understanding, doing what seems right, feels right, I'm comfortable doing it, and it's not bad, it's just not going to lead people to Christ. So, great question.
Thank you.
I find that a lot of times we want to go out 2 by 2 and go out to witness. And I think it's good for the church to have a program, an opportunity for people to go out into the community, come to a place like this, go out knocking on doors, go to a mall, 2 people praying, witnessing together. That's a good starting point. One of the good things about that is you can come home and you're done. But witnessing as you go, it never ends. You're never off duty. You're always on call. But to get you started, wouldn't be bad to go out with somebody. Meet with them every Tuesday, pray, and go. And develop skills, develop confidence, develop your gospel presentation, develop your personal testimony. And then when you're a little sharper, try to the waitress at breakfast,
Right.
Oh.
Go ahead, dear.
Also, I find it interesting to have good prayer time with someone before I go, because I'm always praying this way, as Sarah said, and also this way. But it's really good to get bolstered and washed up and clean and powered up before you go out. But you don't always think about that when you're headed to the supermarket for a carton of milk, a couple of eggs. You don't think about those things, but God puts the opportunity in front of you. So preparing a quick testimony and being conversant with it is a really fine idea. It sounds kind of crazy, but we've all been in business and had an elevator speech. We've heard of the elevator speech. Well, you can have an elevator testimony too, and it works.
Exactly. We all have a life story. Nobody started out being committed to Christ. We started out in full-blown self mode. And so you can always just share your story. This is who I was. I gave God a chance, and this is what happened. It's a very natural flowing thing, and it doesn't require anything except being willing to reach out and love people. Also, a great item that will relieve any pressure that you might have is that you are not going to save anybody. Never have and never will. Only God saves. However, we are in the what I call seed distribution watering business. It's like I got a big sack on each hip and a giant water bottle in one and a bag full of seed in the other one. And as I go through the day, I scatter the seed, which is the Word of God. And I take the water bottle out, which is the Holy Spirit, and I water the seed. And in so doing, I may water your seed from yesterday, and I didn't even know you were here. But that's the way God works. God does that which only God can do. It's not about me making it happen. Anyone else? The mic's open.
Well, if not, we can tell you a little bit more about ourselves and our ministry. Stan is the lead of the First Thessalonians ministry, and As You Go is part of what we do. But a lot of what Mitch and Stan talk about in other shows and what we do the rest of our time is that we help train people to feel comfortable sharing their faith, and then to make disciples of all nations, and to be intentional, to be ready, to be thinking all the time about how I'm going to touch this or that person for Christ. And there's lots of little tips and techniques that we can help with, and so that's one of the things that we do.
Yes. We have some visitors coming in. Welcome.
Welcome.
Thank you. Thank you.
Careful,
Careful.
don't trip on any wires.
No wires here, right?
Good.
The Bible says that iron sharpens iron, so one brother sharpens another, and that's what this is about. We have classes geared with very simple everyday lifestyle tips. It could be as simple as if somebody sneezes, you would say, there you go. See, that wasn't hard.
No, that wasn't what you say. You said, God bless you! In case somebody didn't hear him in the parking lot. Stanley sets up the car alarms when he says, God bless you.
I know he can.
Somebody says, how are you doing today? The normal response would be to say,
I'm okay.
I'm okay, I'm fine. We suggest, and you don't have to do it, but we would suggest that you take the word fine or okay and replace it with the word blessed. Blessed means the same as fine as okay, but it clearly has God's hand on it, because the only one that's going to bless you is God. So a lot of easy, simple tips, and also some more in-depth tips. But basically it comes down to doing, because it says in James that we need to be doers of the word. So it's great to be in church. Pastor gives great messages. It's great to be in Bible study, to learn and grow. But there comes a point in time when you need to be doing it. And that's what our training is all about, and that's what we encourage people to do.
That little thing, I'm blessed. I was in a place, I won't mention the name of the Jewish deli in Cherry Hill, New Jersey, because they threw me out. But I was in a deli. It was a crowded area like this, and, people can overhear our conversations, and the waitress comes over and gives us our drinks. And how's everybody on this table doing? And I said, I'm blessed. She goes away, and she comes back a couple minutes later, not with anything, just to respond to the blessed. She said, more people in America ought to appreciate how good they have it. So I said, well, I'm sorry. When I said I'm blessed, I meant I have a relationship with the God of Abraham, Isaac, and Jacob by faith in his Messiah. And I talked about having a relationship with the living God. As soon as I said that, a man at the table over there said, a Jew for Jesus. It's interesting. I talked about faith, and you recognized me as a believer in Jesus right away. How's that work? And we had this long conversation going. Everybody got involved in it. We went to the car, got books out, tracts out. It was amazing. Of course, they asked me never to come back to the restaurant. But one person was waiting outside for me to come out. When I came out, I said, can I talk to you? I said, sure. Turns out that his son came a believer in college and hasn't come home for the holidays. And he's broken about that. His wife is broken about that. I went back to their house, spoke to their son, shared with him. He came home, witnessed to his family. Dad eventually got saved, not within months. So all I said was, I'm blessed. And doors open, opportunities open, ministry opens up. You never know. You never know how it's going to work.
There we go.
And what a great point Mitch brought up there. You think you're talking to this person over here, and there's somebody sitting over there in the corner who's picking up on the conversation.
That's why you talk loud. Annoy everybody.
One of the things I do in addition to this is I'm a soccer referee. So last year I was at a recertification class to be a soccer referee. And sitting 2-3 rows in front of me, this gentleman sneezed. And so what did I do? Nothing. And I'm sitting there saying, boy, you know better. You're supposed to say, God bless, So I'm beating myself up because I didn't do it. And I know better, So 10 minutes later, God gives me another chance. Somebody else sneezes. So now I yell, God bless you. So this happens like 2 or 3 times. And we're getting ready to break for lunch. And the moderator is explaining to us where the lunchroom is, and I want you back here by 1:45, and et cetera. Somebody else sneezes, and I yell, God bless you. Only this time I did yell a lot louder because they were far away. all across the auditorium, one person after the next started yelling, "God bless you, God bless you, God bless." It was like a choir. It was great. Right. So you never know. It could be something that simple. So.
Right. We were at a restaurant on Saturday, which was an amazing time. We're adoptive parents, and we were meeting with a couple who's looking to adopt. And we did the thing that we normally do, which we asked our server, introduced ourselves, and asked her if there was something that we could pray for her about as we were about to ask a blessing over our meal. And she said, "Oh, you guys have such good vibes." I thought, well, that's interesting. But as we had more conversation, it came about that she is a believer. And when we started to pray, she said, "Can I join you?" And so we're all holding hands in the restaurant, having a great time praying. Now, I don't know who or what heard us around there, but somebody did. And the Spirit of the Lord was in that place because 2 or more were gathered and praying. So that's a beautiful thing. You don't know who you're going to touch. She needed somebody to care for her. She was a very, very busy waitress, and we were able to care for her a little bit in that way. That was a blessing.
Amen.
By the way, I'm not with First Thessalonians Street Ministries officially. I work with Stan Deb, but my name is Mitch Treisman, and I'm with the Friends of Israel Gospel Ministries. I've been involved in Jewish outreach since 1969. I started when I was 10 years old. And we believe in reaching people with the gospel. We believe to the Jew first, but I'll take to the Jew also. And so that's what I do.
Pastor's back with another pastor question.
Go,
Sure.
Pastor.
Over all the years, people come to me, the most common conversations I think I've had, at least in a Lutheran context, have been questions about family, who've either fallen away from church or have never been or are hostile, and it becomes an issue in the family. In your own experience, how do you, in that gentle way, help warm people up, or at least help them understand they shouldn't be threatened by it? So I'm interested to hear what you experienced.
Well, it's very, very hard. I'll say that for starters. And we are living through it right now, Deborah and I. Our daughter, when she was 14, had something happen at church that was not the right thing to happen, and she just, "That's it, I'm out of here," and just shut down. And so it's been 11 years, and 3 weeks ago she came to church voluntarily for the first time in 11 years. So there's no formula here, but first and foremost, love. Love, 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 and love some more. And then do what you can do, but then make sure you allow time for God to be God. Because only God can do what he's got to do. I can't do it. Mitch can't do it. Deborah can't do it. Together, we collectively can't do it. Only God can do that. And then, like it says in Colossians, the 4th chapter, we have to pray and lovingly wait for God to open the door for you to minister. And that's what it's about. And you never know how, when, and where that's going to occur. But it is very hard. It's very hard on the emotions because as a dad, I want to fix this, and I can't fix it. And I can't fix it for my own daughter. I can't fix it for your daughter. And hopefully they won't get too injured in the process. But you can take courage in if they've been raised in the faith and they wandered away. The Bible says that the Word of God does not come back void. So I have probably repeated that to myself 1,000 times, that this is a season. Our daughter Sarah is in the process of coming back. It's just, happening very, very slowly.
Now, I happen to be from a Catholic family, and that's a difficult one, too, because my family feels that they know God, everything's fine, and they don't understand the difference between having a relationship or following a religion. And was a couple of years ago, my brother-in-law was about to pass away, and the whole family was his immediate family was by the bedside. And I was there too. And what was amazing to me, the priest came, the priest left, and my niece turned to me and said, "Aunt Deb, would you pray? You guys know how to pray."
That's great.
And so you can be yourself. You can be your loving person of Jesus. You don't have to bash him with the Bible. You don't have to do those things. Love is really important, and having your relationship, because seeing your relationship with Jesus is a very loving thing. Seeing it being personal.
You want to?
You can if you want to, Mish, but I choose not to bash people with them. You know, I ask them to open it and look at it because there's a lot of truth in there for life. But that was a beautiful thing, to be asked to pray, because they didn't like the priest, and the priest didn't know him, and you can pray personally. You can be personal, because our God is personal.
Amen.
I don't know if Pastor was talking more about children or a family like your Catholic family, so it's hard to know how to answer the question. But I found that there's always been a struggle between having responsibility to be a father and a husband, and then trying to witness to the neighbor. And there are many occasions where I failed one or the other. I remember one time my wife was cooking, and I was working on a computer, and it was raining. And she said, "Mitch, could you drop what you're doing and take the kids to the mall? They got to get something." And I said, "Jack, they've been outside all day long playing. It doesn't matter. Mitch, it's raining. I don't want them out there." "Jack, it's really fine." And she says, "I don't want my kids running around the rain. They don't have to go. Take them. I'm busy right now. You take them. I'm cooking right now." So she drops what she's doing, goes to the mall, takes the kids, comes back. And of course, as she's putting the safes on the table, she's banging my plate down. And she's very happy about all that. Phone rings, and it's Mrs. Horowitz, an 88-year-old woman who I take shopping. And "Oh, Mrs. Treese, I just want to tell you how much we love your husband. He took me to the fish market. Then he drove me over to the kosher butcher. Then he took me over to the supermarket to get what I couldn't get. Then he took me back to the kosher butcher, and he drove me all over, schlepped me to 4 different stores, took me home, put my groceries away." And "Oh, yes, we love him. Oh, sure, no errand is too big for him. No, he'll do anything for anybody except his own kids when his wife asks him to." So I was convicted by that. And you don't know. I mean, I guess I fail. I fail a lot. But thanks be to God, my wife raised them. And
Mercy's new every morning.
All the kids are living. All the kids are living for the Lord today. The boys are all in full-time Christian work, so we're thankful for that.
And we're forgiven. If we were doing this perfectly, if all you had to do was take the 1 Thessalonians course in evangelism and discipleship, and got 100% in the final exam, and you passed with flying colors, you wouldn't need Jesus. But the reality is we do need Jesus, because we fail every day. Sometimes more, sometimes less, but you know, that's what it's all about. It's never about just memorizing scripture, you know, taking out on the right day, slamming it on the table. It's about loving people, you know. So I think we're going to go to a break, but you're going to be first up after the break, unless you want. You want to be up now? Come on up. You're here.
You're here. Come on.
Just tell us your first name.
Marianne.
Hi, Marianne.
Hi. I just have a comment about what Pastor Brett said. The hardest thing is when one of your kids gets older and they've strayed away a bit, and you're trying to get them to come back. And son, I have as a child, a very young child, he seemed to have something the other kids didn't have. I never had to wake him up on a Sunday. He popped out of bed, loved to go to church, and now that he's away at college, he was home for the holiday, and we all went, and he didn't come with us. He just took a drive with his girlfriend and, you know, skipped out. But the way I handle it, I just keep pointing out to him things that we all know. We see things happen to us that they're not a coincidence, and sometimes they're just undeniable. And so when those things happen, we just kind of look at each other, and he knows. He'll look at me, and he'll give me a little wink, like he knows that it's God. And so I know it's all in there, so I keep trying to bring out those things and point out those things that aren't coincidental. So that's the way I handle that. And
That's
hopefully
beautiful.
he'll come back.
Thank
Very
you.
Okay. We are going to take a break now, and we're going to have a praise and worship session here. So participate in that, and then we'll be doing this again in about 20, 25 minutes.
So get your questions ready.
Get your questions ready. Dear Lord, bless the rest of this evening in the name of Jesus, and let this all bring glory to you. Amen.
Amen.
So you accepted Jesus and your sins are forgiven. You go to church. You read the Bible, sometimes. You say peace be with you when you greet other believers. However, isn't there more to being a Christian? Jesus challenged all Christians. As you go, make disciples of all nations. How effective are you at sharing the word of Jesus Christ with others? Tune in to As You Go with Stan and Mitch, sponsored by 1 Thessalonians 3:2, to learn how you can more effectively share your testimony to bring more hearts to Christ.
Hello, my name is Dr. Fred Sylvester from New Hanover Chiropractic, and welcome to this edition of Health Talk. Today we are very honored to have Dr. Stacy Fitch, who's a rheumatologist. She's going to be talking about the condition called rheumatoid arthritis today. And one of the questions that we want to start off with today, Stacy, is what is a rheumatologist?
That's the question I get asked most often in the general public, and it's important because I think a lot of patients are very familiar with a heart doctor, a lung doctor,
Sure.
but a rheumatologist is not something you hear every day.
That is correct.
I'm a specialist that takes care of patients with autoimmune or connective tissue disease, but more specifically certain subtypes of arthritis that fall under that umbrella.
Sure.
In order to become a rheumatologist, you must complete 4 years of medical school,
Okay.
which I did at Philadelphia College of Osteopathic Medicine.
Okay.
And you must complete an internal medicine residency with critical care background,
Sure.
which I did through PCOM and in Einstein Medical Center. And then you complete a fellowship, which is either 2 years or 3 years, depending if you do clinical research.
Okay.
And I completed that at Thomas Jefferson University.
So you come very well equipped.
I hope so.
So with all that study and all the credentials that you have, one of the biggest things that we see from a disease standpoint is rheumatoid arthritis. What is rheumatoid arthritis?
Rheumatoid arthritis is under the subset of inflammatory arthritis.
Okay.
It is a very common arthritis that I see in my patient practice.
Sure.
And basically, patients will experience intense inflammation involving the small joints. What I mean by that is your fingers, toes, wrists, ankles, shoulders, and the neck can be involved as well. It less often affects the spine and the lumbar spine.
Okay.
It, by nature, is very inflammatory and causes swelling of the linings of the joint.
Okay.
That therefore causes degradation of the cartilage,
Sure.
the bones, and actually can cause inflammation and swelling of the linings.
Gotcha. So one of the biggest things that we see, in our clinic as well, is arthritis itself. So what is the difference between just regular run-of-the-mill arthritis and rheumatoid arthritis?
It's an important distinction to
Sure.
make because they're two completely different entities. Osteoarthritis, as I tease my patients, hopefully will all be here long enough to experience.
There you go.
It is a very common arthritis. It affects approximately 60% of the general population.
Okay.
Osteoarthritis means the cushions or the cartilage between the joints become degraded over time.
Sure.
Now, the patients that will be at risk for that, again, if you're overweight, if you aging,
Sure.
so again, we all probably will experience
Sure.
this. Any joint that's had trauma,
Okay.
injury, if mom and dad had arthritis, all these will promote cartilage degradation over time.
Sure.
Rheumatoid, on the other hand, is a more destructive arthritis, tends to affect the younger population.
Sure.
And there is a subset of arthritis that affects children as well, called juvenile idiopathic arthritis, which most people relate to juvenile rheumatoid arthritis, but the nomenclature has changed. But the subset of people that are affected are generally women and men of any various age type, and it makes up about 1/3 of my practice.
Wow. So when you're thinking about, you were kind of alluding to the early signs and symptoms of rheumatoid, what is the early signs and symptoms that you do typically see with a patient who has rheumatoid arthritis?
Rheumatoid arthritis can present in two ways. There are some patients who present with an abrupt onset, where they're feeling well, and within a very short period of time, a few days to a few weeks, can have intense swelling of the joints, again, particularly the small joints.
Sure.
And then there's people that have a more insidious onset, where they start noticing more pain, more stiffness, more swelling, that occurs over a length of time. And what they find is they're taking more and more anti-inflammatories to do the activities of daily living that they normally do. And then eventually it becomes quite explosive, where they realize, I need to see somebody about this. I'm taking anti-inflammatories every day to function.
Yes. So when you look at we'll say the prevalence or the incidence rate at this point, on the national level, I think there's 1.3 million people who are diagnosed annually with RA. I think it's attributable to 50,000 deaths per annual at this time. I mean, when you're looking at 1/3 of your practice being RA, do these kind of dovetail with what the nation's seeing as well?
Very much so. And I will tell you, patients don't always read the roll books. And there is some documentation that women are more common than men, but I would say in my practice it's 50-50. It's a fair game arthritis.
Sure, absolutely.
So you really have to scrutinize and not have gender bias in regards to interpretation and evaluation of a patient for rheumatoid arthritis.
So when we start to get into, like, if a patient presents to your office with signs and symptoms of RA, what is the typical workup for this to differentially diagnose between, regular arthritis, rheumatoid, and anything else like that? And then can you expand on anything like false negatives or anything like that, and how you have to differentially diagnose this?
The most important thing when you have someone in your office that you suspect has an inflammatory arthritis is a thorough history.
Sure.
And I tell patients all the time, what you tell me is the most important part of any piece of information I will obtain.
Sure.
80% of a diagnosis of rheumatoid arthritis will be made based on history and physical alone. So that is a very difficult thing to ask from a patient. People are not trained or taught how to explain pain and symptoms. So what I tell them is, it's just like when you're a child and you're going to write an article. They tell you, write the who, what, when, where, why, and how.
Sure.
So when I'm interviewing a patient and trying to get the signs and symptoms, those are the things I want to know. Where's your pain? How long has it been there? And by the time we answer all those questions, I have a pretty good sense of where I stand with the patient.
Sure.
Family history becomes important, so the rest of the physical history becomes important, and then a joint assessment. I frequently have patients, when I'm examining them, I am palpating their joints, and I'm checking for inflammation, warmth, and swelling. And they'll say, Dr. Fitch, what are you doing? I said, this is called a joint count. So as the doctor is doing that, they're taking a mental inventory of how many joints appear inflamed, how many are warm, and how many are tender, and then that goes into an actual document that gives us a joint score. After that, there is a serologic workup that needs to be conducted. I am known infamously, I think, for the blood monitoring that I do. In order to look for other differentials and other possibilities, I look at 3 buckets of information. I look at an inflammatory bucket of information, an immunologic basis of bucket of information, and then finally a metabolic bucket of information. So just to be brief, so for inflammation, I would be looking for inflammatory markers, things called a sedimentation rate, CRP, rheumatoid factor, CCP, those type of things. And it would also in some genetic studies like HLA-B27. Under the immunologic aspect, I'm looking for ANA positivity, which is a immune test that looks at the blood. I'm looking for what's called extractable nuclear antigens. This is looking for antibody-specific disease states like lupus, vasculitis. For the metabolic portion, I'm looking at things like thyroid. I'm looking at hyperparathyroidism, vitamin deficiencies that may mimic an inflammatory condition. After the serologic workup is conducted, depending on how the patient presents, radiographic studies may be ordered.
Sure.
They would include x-rays, potentially of the hands, wrists, feet, and ankles for staging,
Okay.
and looking for joint damage, erosions. These are
Sure.
the bad words we don't like to
Yeah,
hear
absolutely.
from the radiologist. Sometimes bone scans are ordered to
Okay.
look for other inflammatory conditions, and it's a nice way to look at the whole body without x-raying individual parts.
Mm-hmm.
If it's a joint-specific area and there's an index of suspicion, at times an MRI with gadolinium will be ordered, attention to that joint space to look for particular joint damage and swelling that might be a little more esoteric and difficult to nail down.
Sure.
Once all that's collected, the patient is brought back for a follow-up interview. We do what's called an interval history to see what joint condition has prevailed since, how are they feeling.
Sure.
We review the data, we review the radiographic or any imaging at that time, and hopefully by that point you will have the diagnosis in a nice package for the patient.
Sure.
But it's important for people to understand there is no one true blood test for rheumatoid arthritis.
And I think that's sometimes where confusion lies.
Very much so.
Right.
And as we started this conversation, I said 80% of what I do is based on how articulate a person can explain to me what's happening and my physical exam.
Sure.
30% of the healthy population can have a positive rheumatoid factor. It's an acute phase reactant. It cleaves under stress or that the body can be under at any one given time.
Sure.
But patients with rheumatoid arthritis can also not produce rheumatoid factor or other antibodies. So the American College of Rheumatology came up with updated criteria in 2010, which gives us a battery of questions and joint assessment of physical exam findings that if you meet the right number score that fulfills those criteria, then you can feel with most confidence that the patient does have rheumatoid, even if the laboratory studies are negative.
Wow. So with all that comprehensive exam, all that workup, history seems to be most vital, and still, then you're going to kind of dovetail that with the advanced diagnostics that you're going to do. So now you have a patient sitting in front of you that has been, we'll say, diagnosed with rheumatoid arthritis. What are the current treatments?
Well, there's some old school treatments if you have someone who's more mild, but I tend to be on the more aggressive side because the data in the literature over the last 10 years has really shown that the more aggressive you are in treating someone, the better the outcome.
Sure.
One of the first medications that's been around, it's been around a long time, and it's older than me, is methotrexate.
Sure.
It scares people often because if you Google it or check it on the internet, it's used by many different disciplines in medicine. But rheumatologists deal with disease-modified anti-rheumatic drugs, or DMARDs.
DMARDs, yeah.
So methotrexate in very small dosages has a very calming effect to the immune system on different proteins and inflammatory cell mediators. That's the starting point. If patients are monitored regularly, side effects can be avoided or dosages can be curtailed.
Sure.
What's exciting, as you and I have been out in practice since 1998, there's been a class of medications called biologics.
Okay.
These are protein blockers. And when I came out in practice, the conversation about biologics took me 5 minutes.
Sure.
Now it takes me about 45.
Wow.
There are probably 15 different variations of biologic molecules and how they're administered to patients. And basically, they're protein specific.
Okay.
They are designed to block one particular protein, and not to labor, but one example would be something that blocks TNF.
Sure.
TNF is a specific protein. There are proteins that block IL-6. There are IL-1 blockers. So this is a pretty exciting area. So that in the realm, since 1998 going forward, people should have to worry less about joint damage, disability, and have better function and quality of life.
Sure. Then brings us to the next component of treatment, infusion centers. And, where are they, what are they, and what do you do there?
Rheumatology is interesting in respect that we have many modalities of where we can treat patients.
Sure.
The biologic, which is targeted therapy, can be given subcutaneously.
Okay.
In essence, that means it's like giving yourself a medication as you would in an EpiPen.
Okay.
Some patients are not comfortable with that, and some insurance carriers would rather an infusion treatment. Well, basically, that's nothing more than an intravenous.
Okay.
If you've ever been in the hospital, in the emergency room, or had a procedure, an intravenous has been placed, and probably some IV fluids.
Sure.
Giving a medication that is a biologic is no different than that.
Okay.
It's done in a small setting, a cozy setting,
Sure.
with skilled RNs
Sure.
who are trained in mixing, vital sign monitoring. And essentially, any medication that does not require cardiac monitoring can
Sure.
be administered in an infusion center.
center.
And
Okay.
we're very fortunate because we have that on site in our practice.
Which is fantastic. It's just another tool and resource that we have locally in our community to deal with the rheumatoids and the autoimmune diseases as well. What if somebody decides not to treat their rheumatoid? Is there consequences to it? Is there anything that people should be aware of?
That's a great question because people get very focused these days on side effects.
Sure.
One of my goals as a rheumatologist is to say, listen, your disease has side effects. Untreated disease, particularly if it's moderate to severe, it's not just about the joints. It's not just about having joint pain. It's not just about taking ibuprofen or an anti-inflammatory to keep yourself functioning.
Sure.
This intense inflammation, it's a body that's in chaos, that's asking for control.
Sure.
Well, that chaos can affect other organ systems. Patients with inflammatory disease states of various kinds, whether it's rheumatoid or another subset,
Sure.
are at increased risk for coronary artery disease, heart attack, and stroke.
Sure.
Now, if you treat the disease, it doesn't mean you're eliminating those risk factors, but you are by far optimizing your risk factor profile to benefit your health.
Sure. Yeah. So, one of the things that I've seen very commonly when we've done this show is early intervention better than late intervention, or doesn't it matter?
Early intervention is always key. And since we have these wonderful medications now available to us, life can be changed.
Sure.
And although we are a side effect driven society, I tell my patients all the time, better living through chemistry. There's a reason we're living longer and healthier lives with more flexibility and more freedom and less disability because we have these available. So yes, you are improving your health overall if you recognize the problem, have good conversation with your rheumatologist. I think if you have someone in front of you who will make you feel like you're part of a team, that the fear of treatment should be lessened significantly once you've had that contact and you've had that dialogue. But by far, targeted therapy these days and tight control improves outcomes, and that's been proven over the last 15 years.
Which is fantastic. So if somebody has, some joint pains and that type of stuff, what should they do?
I think the biggest thing is to be in tune with it. All joint pain is not necessarily rheumatoid arthritis, but having the discussion early with your family physician that if it's a change in the nature of what you're used to on a day. We all have routine aches and pains, but when they're escalating and your function is changing, or you start avoiding activities that you normally would do because you're having pain or you note swelling, it's important that you see your rheumatologist promptly.
Sure.
And it's very difficult, and the family care doctors have a very difficult job.
Sure they do.
But if at any thought, at any time, that there is concern for other modalities, a rheumatology consult would definitely be warranted.
Absolutely. So with all the great information you provided to us today, from comprehensive exams to all the different things on Infusion Center, what's your take-home message for this community?
I think the important thing is don't delay your intervention.
Sure.
Although, as I've stated several times during the discussion today, that we are a side effect-driven society, but diseases themselves, if they're not controlled, have side effects as well. Take control of your disease, take control of your life. The more you do to keep your body healthy, it's the only car you get to drive.
That's right.
You can't turn it in for another model.
That's excellent.
Eat well, exercise, and take care of your body, and do the best you can for it. There's many things out there to help you, and all medication is not bad medication.
Dr. Fitch, thank you so much. You've been an excellent
pleasure.
source of information to us today. Again, I think that, it's very enlightening. And again, when we live in a world that has inundated by, the internet and all that type of stuff, and people don't know where to turn, I think the most important thing is the relationship between the family doctor and then the specialists that provide the care that is needed as well. So thank you so much for joining us on our show today.
Thank you.
So again, this is Health Talk, and the purpose of Health Talk is twofold. It's basically to inform our community and to have them make the most informed decisions that they can. Good day and good health.
Just down the street, there's a hardware store with great tools, products,
and expert advice.
We've got everything you need.
Because we know the community.
And we know our customers.
So next time you have a home improvement project,
drop by
your local True Value hardware store.
True Value.
Start right.
Start here.
Your True Value expert is A.D. Moyer in Gilbertsville and Pottstown. On the web at admoyer.com.
Limerick Bowl is the area's ultimate family entertainment center. Your league bowling headquarters for all ages and all abilities. Come in anytime and enjoy daily specials or experience our weekend glow bowling. Celebrate your next birthday at Limerick Bowl with the area's most affordable party packages. Now including our newly renovated Family Fun Arcade. Limerick Bowl on West Ridge Pike. Get more information about upcoming leagues, tournaments, and open bowling specials online at limerickbowl.com.
Do you want to advertise your business, product, or service on TV and the internet for less than you thought possible? It's as easy as 3 simple steps. Step 1, call the PCTV network to set up your private, comprehensive information session about your advertising needs. Step 2, let the PCTV network script, produce, and shoot your personalized commercial for as little as $150. Now that is extremely affordable. Step 3, let the PCTV network saturate the Tri-County area with repetitive hits of your new commercial. It's simple, so easy, and yes, even super affordable. The PCTV network, your hometown station, we're home for you. The PCTV network, powered by TELUS Vision. I'm Al Ganoza, and we'll see you on TV.
Just down the street, there's a hardware store with great tools, products,
and expert advice.
We've got everything you need.
Because we know the community.
And we know our customers.
So next time you have a home improvement project,
drop by
your local True Value hardware store.
True Value.
Start right.
Start here.
Your True Value expert is A.D. Moyer in Gilbertsville and Pottstown. On the web at admoyer.com.
My name is Dr. Fred Sylvester from New Hanover Chiropractic, and this is Health Talk Pennsylvania. Today we are very blessed and fortunate to have Dr. Domney on with us, who is our local pediatrician for Panda Bear Pediatrics. And today we're going to talk about vaccines. Dr. Domney has some extensive experience in this field. She graduated in, I think, 1993 from PCOM. She has her own practice and owner-operator since 2004. She's also an associate professor at PCOM as well, which then she has third-year med students come through, and she teaches them the clinical wisdom of her expertise. We have been having this discussion about vaccines, and we're starting to see some different things rise up here, I think in Connecticut, Ohio, and California, where we see pertussis that is starting to become on the rise, and which was once what we considered eradicated at this time. So, with that being said, what is pertussis?
Well, pertussis is a specific bacteria, Bordetella pertussis, that causes a cough illness. And it's mostly seen with children, but the actual carriers are adults.
How's it spread?
The spread is usually just through respiratory droplets. So if an adult or a carrier was sneezing, coughing, or having any type of cold-like symptoms, they could easily spread it anywhere.
Gotcha. So what are the most common signs and symptoms of pertussis?
Pertussis is a 3-stage illness, and in the first week to 2 weeks, it's just like a cold from any common virus. And so the child will present, or the patient will present with, runny nose, coughing, sneezing. And that's at its early stages. Then it moves beyond that into what we call a catarrhal stage, where they have more increased symptoms of the runny nose and the coughing and the sneezing, and the cough progresses and worsens to a point where sometimes the child will have some difficulty breathing, and that's usually what the concern is. And then finally, once they get through that stage, which is the middle stage, which can last almost 2 to 6 weeks, they finally come to the recovery phase. And that, they will still have some of the coughing symptoms, but the rest of the cold-like symptoms will start to subside. We often dub pertussis illness as the 100-day cough.
So, everybody knows it and distinguishes it by the whooping cough.
Yes,
like you're
the
saying
whooping cough, exactly. Sorry.
And so I guess what happens with it is, like you're saying, when you go through those short bursts of coughs, that's where you get the inhalation in, and they look like they're gasping for air.
Exactly, yes. And that second stage, what I describe is they cough, 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 and then all of a sudden they take a deep breath in to try to recover their breathing.
Now, if a child has pertussis, how do you evaluate them? How do you treat them?
Well, there are certain testings that we could do. Some of them are nasal swabs, and we send them out for specific pertussis culture. That does take some time, almost up to a week. There's also some blood testing that we can do. But once we have diagnosed the child or a patient with pertussis, then it's simple enough to treat with some specific antibiotics. And for pertussis, it would be erythromycin.
Okay. Now, I thought we were discussing this before we started shooting today, and I thought this was really interesting. When you look at it from a national level, say 1940, and we look at how high the incidence of pertussis was, and then you see the introduction of the vaccine in 1945, and you see the causal of that reaction as well. Can you give some insight on what you saw between 1940 and 1945 and 1946, and even to currently today, on the prevalence of pertussis?
Okay. Yes. Prior to the introduction of the vaccine, back in the 1940s, there were almost as many as 2 million cases per year of pertussis, and that was in a time frame from 1940 to 1945. Okay. Once the vaccine was introduced, which was about 1945, we saw an immediate decline of those episodes to less than 200,000 cases per year. And currently, as long as we keep the vaccination program up to date, we may see maybe 1,000 cases per year. So you can see that there's a significant impact with the vaccination program of pertussis.
Absolutely.
To the decline of the disease.
So here's the interesting thing. So we look at California, we look at Connecticut and Ohio, where we're starting to see spikes in. And there was a study out, I think, in 2009, written by Glantz out of pediatrics at this time, showing such a high increase in pertussis rates at this point. I think California, back in as of April 2010, were about 1,800, 2,000 cases, and they usually only have about 2,100 cases per year. What is the reasoning that we're starting to see some, an increase in pockets, of pertussis, as much as, like back in 1959? That's what we're starting to compare some of these numbers to. Why are we starting to see some of these increases?
Well, simply, it's just a resurgence of vaccine refusal. Okay. And a lot of that, parents, especially parents, are concerned about safety of vaccines. And unfortunately, there are other vaccines where there were thought to be some causal relationship between a vaccine and some side effects or certain illnesses, and that has been proven to be not true.
We are looking at a small niche of the population that's really vulnerable at this point. And it seems to be the infants, but I thought by doing this research, what I also found very interesting, and we had talked about this as well, is that the reason that the infants are truly exposed to this is because of their caretakers. Can you explain that?
Sure. Yes. The Bordetella pertussis bacteria is actually specific to a human host. Okay. So it's actually an adult that will carry this organism, and because the adults, unfortunately, sometimes are not as well vaccinated as our children, they're the ones that are passing it on to the child or the baby that they're taking care of. So,
which then brings us to our next question. Why do you have to have boosters on the vaccine?
Exactly. That's for that reason, because the vaccinations, immunity doesn't last forever, and so it is very important, especially for adults or any caretaker of children, to get that booster dose of pertussis vaccination.
Which I think is really, a misconception. A lot of people, they go from the old school where they think they've been exposed to something, then you have that immunity for life. But that doesn't seem to be the truth when you're dealing with vaccines. Is that correct?
Exactly.
Okay. Mm-hmm. When you think about it and all the wonderful information you've provided to us today, what is your take-home message out of this whole thing?
Well, my take-home message would be to understand the importance of the vaccination program, not just for pertussis, but for other illnesses that we've been successfully been able to eradicate out of our community, but also important to understand that everyone should get their vaccinations. So not just children and babies, but also adults, especially those adults who will be taking care of our children and our babies, because they will be the ones, unfortunately, who will pass on this specific bacteria to the children.
Well, I want to say thank you very much, Dr. Nami, for coming on the show. You've presented us with a lot of great information, a lot of food for thought, per se. And, I think what has happened here is that vaccines have actually become an enemy of their own success, if we can imagine that. So, again, with our healthcare and with our system that we're looking to continue to improve upon, we also want to make sure that we're making decisions off of the evidence and what is most out there. There has been tens of thousands of researches out there that support the efficacy of vaccines, and very, very limited evidence out there that supports the non-efficacy of these treatments and these vaccines. So again, I just want to make sure that we bring that stuff to light and make sure that we continue to improve our community through knowledge and what the evidence is actually directing us towards. So I just want to say have a great day and good health.
The first meeting is really a get-to-know-you meeting. We're going to sit down. Typically, the meeting will last about an hour. We're having a conversation. My job is to ask them some questions about where they are, what some of their goals are, what some of the key objectives they have in meeting with me, where they are to this point, and really what brought them in to see me. And now I'm at the point in my career where I have a lot of people that are dependent upon me to provide them with all the guidance and all the advice that we do on a day-to-day basis.
You spend your working years trying to build up your assets, trying to build up pension credits at your job, trying to grow your nest egg so that you can one day retire when you can't work or don't want to work anymore. And that's a period followed by phase 2, which is retirement. And your priorities in these two phases are very different, but many times we see people don't make that shift and they still act like they're in phase 1 when they really should be acting like they're in phase 2.
We're going to talk to you about what we commonly refer to as the second half of the game. And what I mean by that is you're working your entire life towards retirement, and I'm assuming that most of you are, at that age where you're starting to consider some of your options as you move into retirement. And as you do that, you're moving from what we call the accumulation phase of your life, where you're accumulating your assets. Maybe you're participating in your company's 401k. Maybe you're contributing to an IRA account or a Roth IRA account or some type of retirement vehicle. And now, as you retire, you're transitioning into the distribution phase, or the part where you're going to need income in retirement. So we're going to talk about some different ways to do that with an emphasis on Social Security.
Welcome to Financially Speaking with Jeff Bush. I'll be the host today. My name is Steve Jablonski, and we have a really great topic today. Considering where the market's at an all-time high, we're going to be talking about risk, and more specifically, Riskalyze, which is what we use to help our clients really define their risk. And with that said, Jeff?
Well, hello, Steve, and welcome to the show. First, let me say it's great to be here today on PCTV. And for you, Steve, of course, this is your very first show, so welcome. we're grateful to have this presence not only here in the Pottstown area, but also via the World Wide Web on the PCTVnetwork.com, and of course our website, which is informedfamily.com. So a great big thank you to our friends here at PCTV. Today we're going to talk about Riskalyze, which is the program that we use with our clients to measure risk and to allocate their portfolio really according to a scoring system.
Yeah, one thing we found today is that when we using Riskalyze is that investing is broken. Why do you think that is, Jeff?
Well, investors naturally have a tendency to buy when things are good and sell when they get scared and therefore missing the recovery. Buy back when the markets feel safe again and repeat until broke. As you can see up here on the screen that we have, there's this, the markets are cyclical. We like to say, this is not your father's stock market. The markets go up and the market goes down. So it really takes a lot of discipline to be investing in today's market.
Yep, and that's why we believe that the short term really does matter. And it really stems from our definition of risk tolerance. It's how far a portfolio can fall within a specific time period before an investor will really start making some poor decisions, where they will start making knee-jerk reactions, and at this point they really don't think about their long-term goals and how a short-term decision can actually affect those long-term goals.
Yeah, I mean, it's the discipline that we like to employ at our firm is, to look as long-term as you possibly can. Okay, if you have a short-term goal, then we really should be steering clear of the stock market. And all of our research points to a simple truth. While investors should be focused on the long term, they react to risk in the short term and sometimes overreact to risk in the short term. And these emotional reactions, Steve, are to risk are the number one killers of long-term financial goals and results. And all you need to do is point back to 2008 as a perfect example of that.
Yeah, and a lot of it stems with all the information that's out there today. And a lot of advisors will give their clients big books of information. I mean, we had an instance the other day where one of our clients said, please don't give us a huge, thick report because a lot of it has nothing to do with me, and a lot of it I don't understand. So one of the great things about Riskalyze is that it's very specific to the client, and the clients get it. It's very easy to understand.
Yeah. Well, Steve, of course, you've been working with our Riskalyze software for quite some time now, so you kind of know all the ins and outs, and it really is a simple system. It's simple yet effective.
Yep.
The old way of assessing risk, stereotyping investors with subjective semantics based on their age, simply doesn't work. So in other words, if you find a 25-year-old, you say, okay, well, we've got to put him in an aggressive position because he's got a long time horizon. When in fact that may not be the case. Right. If you give him the scoring system, he may in fact score out at a different level. And yeah, you're right. Investors are confused, and the client that you're referring to, he got that big report from another firm, and it really doesn't do anything. I mean, it's just a lot. These big reports just spew out a lot of statistical information, but what really makes Riskalyze effective it's you. It's your score. It tells us where you are. And getting back to this, these stereotypes, the folks at Riskalyze actually did a study, and they found this is interesting. 52% of investors between the age of 20 to 29 are not aggressive. So about half of 20 to 29-year-olds aren't aggressive. And conversely, 53% of investors between the ages of 70 and 79 aren't conservative. So advisors really need to be empowered to treat their clients as individuals.
Yeah, and a lot of times, Jeff, when historically speaking, and people focus in on a return, and let's say the S&P 500 returned 9% over the last 20 years, it only has returned 9% once. So what happens in the short term is clients will say, wait a minute, we're talking about an average of 8 or 9%, but I only had 2%. And so it should be really focused in on someone's risk first and then return second.
Yeah. So simply stated, the way we invest for our clients is putting risk first. And it's really about, what you're really saying is it's about asset allocation.
Yeah.
When you can do this and quantify risk alignment, that's when you can empower fearless investing.
Yeah.
Let's talk a minute about fearless investing, because really what that means is you can take what's happening in the short term because you really have a much broader goal and a much broader outcome. Because the reality of it is that you're going to have extreme volatility in the short term, be it good or bad. And as you stated at the top of the show, the market's at or near all-time highs. So what does that mean? Well, it's volatility right now. We're on the positive side of that, but it's not always going to be that way, as we all know. Yep. But there's a lot of emotion here, and we're trying to take the emotion and the fear out of investing.
Yep. And so what we do is it really starts with the risk number, and a lot of times what advisors will do is they'll put somebody, as you said, into a conservative or moderately aggressive shell, and that really doesn't have anything to do with how far their portfolio could fluctuate. And so we come up with a risk number first, and when we compare this, or a good example is 1, it goes from 1 to 99, and 1 would be sitting in cash, 99 would be in one holding like Twitter stock. The other thing is we think of this as a speed limit. So if you're driving 25 miles an hour versus driving 85 miles an hour, the 85 is going to have a lot more risk, a lot more capability or probability of a crash, where the 25 mile an hour is actually very, very slow and safe. So it all gets down to the number and then the range that it can go invariant.
Yeah, so really that's good information to have. And what we're going to do today is we're going to make an offer to our viewers, and that is we're actually going to offer to do a risk-aligned report for anyone who's interested. So we'll actually do 2 things. We're going to give you your score of how you should actually be, how your portfolio should actually be allocated. What's your number? Yep. And then the other thing we're going to do is we're going to look at your existing portfolio and see where you are right now. Yep. So we're going to take your 401k report or your IRA account or any other investment account, and we're going to plug those numbers into our software, and we're going to give you a number. Now, in a perfect world, Steve, those numbers should match, right?
Right.
So, but what we have found is that they rarely do. Right. They rarely do. And the other thing that this report does is it gives you like ranges of what you're comfortable with. So you can, in other words, yeah, the market's at an all-time high, but what's going to happen if we get a correction, which we will eventually. We'll get a correction. So what will investors be able to tolerate? Will they be able to tolerate a 10% correction, a 25% correction, a 50% correction? Right. There's a lot. What I found was when going back to 2008, we had a lot of people say they were aggressive, say they wanted to be in the market, but once the market started going down, they bailed. They wanted to bail. And really, they bailed at the wrong time.
Yep.
They bailed at the wrong time. And, one of the slides that we showed earlier, we're way back in the beginning, the roller coaster one. So where their greed and they're buying high at the market, and they're selling low at the low market. So right now we're at the high market. So we're not saying here today that we should not be buying today. But all we're saying is it needs to be part of a systematic plan. We have to be investing in the right fashion for what's right. So that's the free. So the free offer is we're going to do a risk-aligned score for you. So you can contact us a couple different ways. You can either contact us through email at our info@informedfamily.com, or you can give us a call. Our phone number's up there on the screen. So contact us, and we'll be sure to get that risk-aligned report out to you.
And another thing is that we have some upcoming seminars coming up. And if you see, we'll get them on the screen. We have a couple in January.
Yeah, so we do these. So we take the show on the road. So today we're here in the studio talking about risk-aligned, but we're going to be on the road. You can see here up on the screen that we're going to be. We have a couple of upcoming events. Give us a call or email us, and we'll get you some tickets if you want to come out and see us. Now, what we do at these public seminars is we focus on the topics that are important to consumers. So this is just one topic that's important to consumers. So we talk about risk. We talk about Social Security as another hot topic. We've been doing a lot of Social Security workshops over the past several years. And then another big topic right now, Steve, is fiduciary.
Okay. Yes.
So I know it's somewhat of a big word. And what does fiduciary mean? Well, it means that you and me, as financial advisors, have the responsibility to always act in the best interest of our clients. So we have a fiduciary role. So why is that?
And how does that compare to suitability?
Well, there's two different things. So suitability means that you're making an investment recommendation to a client that's the investment is a suitable it's a suitable investment. It'll meet their needs. Yep. A fiduciary role or fiduciary capacity means that you're acting in the best interest of your client.
Okay.
So you're doing what's truly the best interest of your client. So it's a different level than what suitability is, and that's really important to consumers. And as we progress through time, you're going to hear more about that. But the best example I can give for fiduciary is if you're named the executor of an estate. So let's say that your dear old aunt names Steve as the executor of her estate, and your dear old aunt dies, and the beneficiaries of her estate, let's say that they're your three cousins, let's say, her kids. So what your job is as the executor, you're acting in a fiduciary capacity. So you have to act in the best interests of the beneficiaries. Yeah. So you might have to sell the house. Yeah. You might have to position the investment portfolio in a way. You might have to sell some stock to create liquidity in the estate. Yeah. Well, how are you going to do that? So you have to act in a fiduciary role. So it's not just you're not acting in a selfish role. You're acting in a fiduciary capacity to act in the best interest of the beneficiaries. So that's really what fiduciary is. So let's talk a little bit about who we are here at Informed Family. So we've been around the block a time or two. Steve, it's great to have you here in our firm. You have over 20 years of experience in the financial services industry. I have over 20 years of experience in the financial industry. Our good friend Barry, our other advisor, he's got over 20 years. So between the three of us, we're pushing 65, 70 years of combined experience. So what does that mean? Some of that, well, it means we've taken our lumps over the years. We've been able to see a lot. We've worked with a lot of clients, good and bad. And it really, we're kind of, warriors, so to speak. So we love to work with people. We have a lot of clients right here in the Pottstown area, as well as other parts of, the greater Philadelphia area, and we really love what we do.
And let me ask you, Jeff, when we talk about planning first, what does that mean to the firm?
Well, our motto is planning first and then investing second. So financial planning means that what we want to do is we want to get to know our clients. Yep. We want to know what their goals and objectives are. We want to know what the future has in store for them, yep. How they see the future unfolding. Once we can define that, and sometimes that takes a couple meetings to do, depending on the complexity of their situation. But once we can do true financial planning, yep. Then the investing kind of follows suit. What I've found over the years is when we skip that step, either by design or, the client's coming in for one specific thing, or maybe, we don't follow our model. Yep. That's when things go off track. Yep. That's when, it's kind of like swimming. You're swimming upstream or climbing uphill or whatever term you want to use. But that's really where the importance of financial planning comes in. Yep. And really, as it relates to our topic today, Riskalyze, with Riskalyze and asset allocation, these are all effective tools that we use as financial planners, yep. As financial advisors. Yep. And when you have a plan in place, well, then you can go out and invest. Then you can set up someone's portfolio in such a way that it's going to meet all their goals and objectives. What I've found is, through my experience, is that people generally underestimate how long they're going to live, yeah. And how long they're going to live in retirement. Sure. So if you're talking to somebody who's 60, 65 years old, there's probably another 25 years of life there that we've got to plan for, maybe more. Yep. People are living longer. People are, we're planning, when we do our planning, we assume people are going to live into their 90s now.
And that's one reason why asset designation is very important.
Yeah, we strongly believe in that. That's maybe that's a topic for another day. Asset designation, and that goes along with our asset cycle portfolio system. But all really what that means, Steve. And that was good that you interjected that into the conversation this morning, because what that really means is that when you're doing asset designation, you're giving everything that you own, you're giving a job description to. Yep. So it's not everything sitting in one pot. Yep. You're saying, okay, this asset that I have is truly a long-term asset. Yep. Or this asset I need for income now. And what we have found is once we can get our clients to see that, once they can see that, oh yeah, we've got that asset. That's for 15 years down the road, or that's money that we're probably never going to spend. That's money that's going to go to the children, or what sometimes we refer that to leave on money. Yep. So there's live on money, and then there's leave on money. Yep. So the leave-on money, sometimes, well, that, you know, we can take some more risk with that. And then people say, oh, yeah, that's money we're never going to spend. Yeah, that's, you know, we can take equity risk there. So that's probably a topic for another day, but we'll get into that a little bit more, you know, for those people that, you know, are tuning into us on a regular basis. We'll spend some time talking about the asset designation or the asset cycle portfolio, if you will. So, with all this being said, we want to talk a little bit about, you know, our locations too. So we have an office right here in Pottstown at 152 East High Street. So for our local viewers, we're right downtown in the old Security Trust building, that building right on the corner of High and Hanover. It's got the big brick building. We're up on the 4th floor of that. We've been there for 11 years now, believe it or not. So we have a nice presence in Pottstown, and we really enjoy it. Of course, I live in Pottstown, so it's, you know, that office is convenient for that. And then, of course, our main office is down in the West Norriton area, right outside of Norristown. So, you know, we've got clients all the way down Route 422 and all over Montgomery County and spreading into Chester County and even into Philadelphia County. So, you know, when you've been at it as long as we have, you know, we've been able to, you know, meet a lot of nice people along the way. If you need to contact us, we have our information up on the screen. You can see there. You can email me at info@informedfamily.com. Remember, we're offering the Riskalyze report today. So if you want to email me for that, we'll get that out to you. Or if you want to talk about any other topic, if you want tickets to an upcoming event. In fact, what I want to do right now is I want to put the up on the screen. I want to put the upcoming seminars that we have, our workshops. You can see there that we're taking the show on the road, which we typically do every month. We'll do 1 or 2 workshops in the area.
And these are Social Security.
Yeah, these are with an emphasis on Social Security, but we touch on other things, like we'll touch on income planning. We'll talk about we'll talk about the Riskalyze, the risk software that was the topic of today's show. You know, we'll touch on our roles as fiduciaries, the asset designation. We really kind of mix everything in there together, because really, you know, you never want to make your Social Security decision in a vacuum, because there's so many other factors that go along with it. It's kind of like baking a cake, Steve. You know, you're putting a lot of ingredients into it, and you know, when you're looking at Social Security, you're really looking at a lot of other aspects to your financial world, in addition to Social Security. So with that being said, it was a great show today. Steve, welcome again to the world of Informed Family here and Financially Speaking with Jeff Bush. So with that being said, we're gonna sign off today, and we'll see you the next time here on Financially Speaking with Jeff Bush.
In case you don't know, I'm Terry Musser, and I'm 26 years old in the real estate industry. I have never seen a better time to buy a home. The interest rates are in the 3s. Our market out here has been great. So even if you're selling, we can do it all. And a lot of people ask me, Terry, you've been doing this 26 years. Can you still do a cartwheel? And let me show you my response. We still got it.
Hey, listen up. It's time to love your heart. Go to clevelandclinic.org/loveyourheart and learn what really matters to that lovable heart of yours.
Welcome to Understood.org, a free online resource for parents of kids with learning and attention issues, with personalized recommendations, tools, and expert advice.
So I want to take this opportunity just to let you know that Chestnut Knoll at Home has 2 offices, one in Phoenixville and one in Gilbertsville. We offer part-time and full-time positions. We have a 401k program that goes into effect 1 year after your employment. We also offer paid time off. We offer flexibility of hours and the fact that you're out there making a difference in someone's life.
The feeling that they matter in this world, especially the elderly. I think they're so overlooked sometimes. And if they don't have family members and you might be the only person that touched their life that day with a smile.
Flexibility is great because I'm a college student. I'm meant to be an RN, and they work around my schedule really well. I give them enough time to when it's going to change, and they put in for me. I have no problems, and that's a great aspect to the company as well.
Single mom, so I could still see their sports, still be there for dinner, still be around on the weekends, still pick up a couple hours here and there. But ultimately ended up just making this is what I was supposed to do, work in home care.
This land is your land, this land is my land, from California to the New York Islands. From the redwood forest to the Gulf Stream waters, this land was made for you and me.
Hi, I'm Allison Klein-Sherman from Klein Transportation, and I'm here today with Krista McCusker. She's our sales and marketing supervisor, and she does a wonderful job for us leading our team of sales specialists to provide excellent service for our great customers. So today we're here with one of our school buses and motor coaches, and we're going to tell you a little bit about what we can do with these motor coaches and school buses to serve you and the community. Krista, tell me, what different size vehicles do we offer for our customers here?
We have a lot of different variety. We have mini school buses that can accommodate 20 passengers, and we have full-size school buses that can accommodate up to 48 adults. Our motor coaches, we have motor coaches that can accommodate 36, 47, or 54 passengers.
That's great. And also we have ADA accessible vehicles as well.
Yes, we have a lift coach available in each option, a school bus option, as well as our full-size motor coach option that can accommodate either 1 or 2 persons in wheelchairs.
Okay, great. We're going to step on board one of our motor coaches and tell you a little bit more about what a motor coach offers for groups.
Okay, Krista, so right now we're inside one of our motor coaches. Tell us about this motor coach that we're on.
This is one of our full-size motor coaches. This is a 54-passenger motor coach, and this has a lot of different amenities for our group leaders. Everything from reclining seats and armrests to footrest. We also have full Wi-Fi services in all of our motor coaches.
Also, you see the monitors that are projecting. We do have a capability of having a full media package for our group leaders as well, so they could educate on the way down or show YouTube videos and stream things while they're traveling somewhere. So driving by motor coach is really a different experience than what it used to be.
Absolutely, you're right. So tell me about some of the different types of groups that call into the office regularly.
Well, the great news is that anybody can be a group leader. We have a variety of different groups that call all the time, from the obvious that everyone thinks of, the senior groups and school trips. But we also have special events like weddings and bar mitzvahs where people want to charter a vehicle such as this. We have a lot of different types of groups calling all the time, and the good news is we usually have a vehicle and the amenities that they're looking for in order to take their group where they want to go.
It's great. Yes, and really, groups can use motor coaches for leisure travel, for business travel, for events. They can be used for shuttle services. There's really so many different options that a motor coach can be used for.
There really are. There really are.
So when a group leader calls in, whether it's a new group leader or a seasoned group leader, what are some of the things that we offer to our group leaders to help them with their travel planning?
Mm-hmm. Some of our group leaders really have a great idea of when they want to leave and when they want to get there and what they want to do when they're there, and they plan that all on their own. But there's other group leaders that just kind of call with an idea, and we can help foster that idea along. So maybe they have an idea of when they want to get someplace and a idea maybe of what they want to do. Well, we can help investigate and plan their itinerary for them, starting with their departure time and ending with their arrival back home, and anything in between. So tickets to events or traveling and touring different venues to even lunch options. We can take care of that for our group leaders.
Great, and we can package also where they're receiving a price either for just the transportation and they can purchase their own tickets or whatever they want to do when they arrive at their destination, or we can do that work for them and give them a package price that's per person. So it already includes all of the attractions and meals and hotel accommodations if they're going overnight.
Yeah, it helps the group leader immensely when we do that, because it gives them a really solid idea of, if I have this many passengers, then this is what my cost is going to be per person, and it really does help them.
Some of our customers are also very savvy with the computer and like to do things on their own that way, and some of our customers have requested already for us to type up a nice, pretty-looking itinerary or flyer for them to send out to their customers. So we've also offered that service in the past, too. So with our business travel, like we talked about, we have some customers that have used us for training, like you said. So how did they organize that day?
Yeah, absolutely. I have one customer in particular that comes to the top of my mind that does continuing ed credits for educators. So he chooses a destination once every 3 or 4 months, and he sets up a trip for his educators to go somewhere. I think the most recent was to the Inner Harbor. So he used our full media package and did education the whole way to the Inner Harbor. The group had an event there while they could tour on their own for a few hours, and then rode back on the motor coach. So we had all that time to the destination and from the destination to do education. And the nice thing was his passengers not only walked away with a great experience, but they also walked away with some continuing ed credits, which was really a benefit to them.
Absolutely. Now, also another thing that we offer our group leaders is our familiarization tours or FAM tours. Mm-hmm. Tell me about some of the offerings that we've done with that. We've done the Pennsylvania Bus Association Marketplace. How is that day set up and what do they do there?
That's a really great day for anyone who would like to become a group leader or anyone who is a group leader. That particular day is a lot of fun because we not only get to tour the marketplace, where we get to investigate some different new places that maybe group leaders have not thought about going. It's basically like a big fair with a bunch of venues set up where folks can go and talk to people from these locations that are all set up in one area. Our most recent one, and I think we'll be doing that again in the spring, is to the Spooky Note Complex for the Pennsylvania Bus Association. And it's a really great day where we spend half of the day touring new destinations and looking at new things in the marketplace. And then the other half of the day we get to be tourists. So I think this particular event coming up this spring, we'll be doing Sight and Sound Theater and the new offering that they have there, the showing of Jonah, and then we'll also be going to Plain and Fancy for lunch that day. So it's really a day where folks can really get an idea of what our motor coach offerings are, and then kind of also some different places that they can tour and some things that they can do.
And the great thing about Pennsylvania Bus Association is over the years they try to pick different locations for where their event is going to be held. So in the future months, I believe they're looking at, or in the future years, they're looking into going to York. So that will give group leaders the opportunity to explore that area as well. Another offering that we do is with Greater New Jersey Motor Coach Association, and that event takes place in Atlantic City. So that's another annual event that we go to every year for our group leaders and take group leaders to help them learn about different destinations and get ideas for where they can take their groups. So we like to do a lot to offer our customers to help them learn about different destinations and become familiar with what they can do with their groups. So Krista, when a customer calls in, what can they expect calling into our office?
Well, they can really expect an easy process. Our customer service representatives are there to assist them in not only offering them a great price for their trip, but also to help walk them through it. So we will start off by just asking them for their contact information and then move into actually quoting their trip. So starting with when they want to leave their destination, where will that be, and helping them even sometimes selecting where that destination or where that departure point would be from, and then building their trip as they desire and walking them through that process. In the end, we can offer them a price on one vehicle or multiple vehicles, so they have an option of choosing between different types of vehicles based upon price or whatever else they may look for. But we do price by we have variable pricing, which means that we will price by time, miles, and the day of the month or the day of the year that they're looking to travel. So we do have a peak season, just like airline travel. We have a peak season and a value season and a discount season. So it really kind of just depends, but we like to work with our customers too. So if your dates are flexible, we like to be able to make that available to kind of work with them to offer them a very fair price value for the value that we have here at Klein.
Great. So you mentioned school buses. What are some of the options that we have with school buses?
School buses, we have a few different options as well. We have a 20-passenger mini school bus, and then we also have our full-size school bus that most of your children, would typically ride on, and that does seat 48 adults comfortably. Mm-hmm. If you are traveling with children, it can fit, I believe, up to towards 70 children. Safely. Our school buses have a lot of different options. We do have a lift-equipped mini school bus, and we do have seatbelts available and air conditioning available upon request as well.
So school buses, while they are the transportation mode for students to get to school, they're also a lot different than what they were when I went to school. Many of the school buses have tinted windows. Like Krista mentioned, there are some that offer air conditioning. So while it's not the same experience as riding on one of these great motor coaches that we're seated on now, they do have some different offerings as well. So we really look forward to hearing from you and you calling into our office and talking to you about what we can do to help you become a group leader. And if you already are a group leader, what we can do to help your group have their great next experience.
Absolutely. Absolutely.
John Coakley, our Vice President of Operations, has joined Krista and myself to talk to us a little bit about school bus transportation and what we can offer for groups and local schools with school bus transportation. So John, tell us a little bit about the history of school buses and Klein Transportation.
Klein Transportation, we started as a school bus company. In 1957, we got the contract for Daniel Boone School District, and we've had it ever since. We've been transporting kids, and that's why we are so good at transporting everyone. If you start with kids, you do a good job.
And that's something we're very proud of here, our
Definitely.
history.
Absolutely.
And the fact that we've been a family-owned business for such a long time providing service to our community.
Right.
So we now offer school transportation for other schools in the area. And how does that work?
Well, no, sometimes school districts are not able to provide their own transportation with their own school buses. So Klein's has a program where we can use our school buses to supplement their school bus transportation. Oftentimes this is when they have sports and field trips that would not work with the times of their regular school bus runs. So we can sign an agreement with them that allows us to transport their students on our school buses. Okay. We think it's a really great program for the school districts and saves them a lot of money.
Absolutely.
And it can be really seamless as well, because all of our school bus drivers and our motor coach drivers are all fully safety certified and checked, which means that they have the different clearances that even school teachers have, state and federal clearances.
Yes, right. That's great to mention, Krista. Thank you.
Right.
So with the schools that we work with in the community, some of them we're doing just a few trips here and there, and some of them we're working with on a contract basis, right, that we're doing all of their extra work. That's correct?
Right. It can kind of be what they choose. Some schools just need a trip here and there. Other schools, we do all of their athletic transportation or all of their field trips to help them out.
Yes. So, Krista, what are some of the types of groups other than schools that we've dealt with that have used school buses for their transportation?
Well, school buses can really be a great alternative to motor coach transportation if you have a large group of individuals. As I said, this is one of our large school buses that seats 48 adults comfortably, but we do have a smaller option for 20 passengers as well. And these groups can be anything from weddings and special events. We can shuttle guests to also different major events that maybe you park at one place and shuttle your guests to a different place. So different contracts that we run with different major events as well.
Great.
Much like our school district contracts where transportation management's necessary, if a customer had a large convention or if they needed a huge amount of people moved, that is a great job for our school bus fleet to do. And then we can also have an on-site transportation team that could run the entire show for them.
Great. That's absolutely something that we've provided for our school bus, large conventions with school buses, and also large conventions with our motor coaches as well. And when you're dealing with a large event and a large number of people and a large number of vehicles, it's really important to have that experience involved. Really having a handle on how that all runs and works is invaluable. For an organization. The last thing you want when you're having a big event is for something to not go right because you're not dealing with experience. Right. So in the school bus, this particular bus has the tinted windows, and we were talking about earlier about some of the differences between the old style buses and the new style school buses. Gone are the days of the manual open the door that's air operated now. Right. Push a button and the door opens. What are some of the other things that have changed over the years with school buses?
Well, let me start with this as well. We have a fleet of charter-specific school buses, meaning school buses that we use specifically for group leaders that call in and order our school buses. That is separate from our school bus fleet that's used for school transportation. Now, why is that important? Because that means we can offer a little bit of a higher level on our school buses. So we have some that are used for charter that have luggage storage bins that have air conditioning, as you mentioned. We have some that we can hook up an iPod or something like that that can play through or some other electronic device that can play through the speakers. So just to add a little bit extra special touch to the normal school bus body.
Great.
And then, as you said, in addition to that, safety is an important part. We have school buses by request that have seatbelts for each passenger. It's kind of a big issue right now for some customers, so we want to make sure that we service our customers by providing that as well.
Great. So really, a school bus provides a lot of different options for a lot of different types of groups. Mm-hmm. Thank you so much for sharing that information with us, John and Krista.
Thank you.
Hello, I'm Wayne Klein, President and owner of Klein Transportation, along with my wife Adele. We've been providing passenger transportation since 1957 for students going to Daniel Boone School District and charter business since 1979. Allison, our daughter, is actually the representation of the fourth generation of the Klein family.
We invite you to join us to go to many fun travel destinations. Our motto is half the fun is getting there. We are so proud of all of our staff of travel specialists. Whether you contact us by phone or online, we help you choose a Klein tour, a casino trip, or to schedule your transportation by motor coach or school bus.
Let's step on board and choose our next destination.
Welcome to American Music Theater. Each year, our 1,600-seat theater, located in Lancaster, Pennsylvania, hosts more than 300 live concerts and performances, including national Broadway tours, rock, country, and oldies concerts, top-name comedians, and family-friendly original shows. We've welcomed Grammy, ACM, CMA, Tony, and even Oscar winners to our stage. No other theater in the region offers a wider variety of live music and stellar performances year in and year out. American Music Theater, Pennsylvania's premier venue for live entertainment.
Hello, I'm Wayne Klein, President and owner of Klein Transportation, along with my wife Adele. We've been providing passenger transportation since 1957 for students going to Daniel Boone School District and charter business since 1979. Allison, our daughter, is actually the representation of the fourth generation of the Klein family.
We invite you to join us to go to many fun travel destinations. Our motto is half the fun is getting there. We are so proud of all of our staff of travel specialists. Whether you contact us by phone or online, we help you choose a Klein tour, a casino trip, or to schedule your transportation by motor coach or school bus.
Let's step on board and choose our next destination.
There's a world of excitement, there's a world of fun. Won't you come and give it a whirl? To all the sights and sounds happening all around. At Hershey's Chocolate World, it's the sweetest place on earth to be. Every season filled with your own fantasy. It's the flavor of fun for everyone at Hershey's Chocolate World. The flavor of fun for everyone at Hershey's Chocolate World.
The stylish cabin reflects the quality of Klein service that you have come to know and expect. Comfortable seats with first-class legroom and LED-lit interiors create now a sense of drama and elegance. We invite you to join us on board our new MCI J4500 to the destination of your choice. We offer group charters and travel planning assistance for group leaders. Klein Tours, pre-planned one-day trips, and overnight excursions for individuals or small groups. And of course, our regularly scheduled Pennsylvania or Atlantic City casino trips.
Hey, this car's been around for a while, but it's running great. So am I, Terry Musser. I've been around for a while, and I'm running great. So if you want some experience, somebody that's been there and done that, but still has the energy, you call me. Because I have a team of people, we have all of the networking you need, and we have the knowledge. And you just can't buy that. But you'll get it when you choose Terry Musser and his team. Give us a call. You'll be glad you did. Happy trails.
For more than 50 years, Pottstown Oral and Maxillofacial Surgery has served its community with expert dental care, offering patients dental implants and a full menu of procedures for many types of dental problems, including bone grafting, wisdom teeth, impacted canines, facial trauma, jaw surgery, oral pathology, TMJ disorders, and sleep apnea. Get the smile you've always wanted. Contact Pottstown Oral and Maxillofacial Surgery today.
Hey everybody, Terry Musser. I'm back and want to talk to you about your house. It's a big investment. You've put a lot into it. And you need a real professional. Hey, when the lights go out, you need an electrician. You don't want to do it yourself. Same thing happens. Carpentry, you know, you need a real pro. You need to get yourself a carpenter. And when you have a real emergency, that's when you want to call Terry Musser. I'm here to help you with all your needs. No plumbing needs, though. That's when you need the plumber. But for your real estate needs, it's a big investment. I have all the tools of the trade. So we'll measure your house. I have an iPhone. In fact, probably one of my customers will call me now. Hi, this is Terry. Oh, yes. I can be over on Sunday. That's not a problem. But I'm busy right now, so I'll get back to you, and I look forward to meeting you. We have the iPhone. We have an iPad. We use all the technology, Realtor.com, Trulia, Zillow. 26 years of experience, still passionate. So I want you to call me, Terry Musser. Love to work you. Small house, big house, any house. Give me a call, and you'll get my personal guarantee of great customer service. Thank you.
Hello, my name is Dr. Fred Sylvester from New Hanover Chiropractic, and welcome to this episode of Health Talk. Today we're going to be talking about child safety seats, and we have Officer Decker Dias here with us to give us some information on that. Officer Dias graduated from Boyertown in 1999, and then went on to earn his bachelor's from Penn State in 2004, and then eventually went on to earn his master's in criminal justice from Tiffin University in 2011. He's currently employed at New Hanover Police Department since 2006, and in addition to some of his normal responsibilities of being a police officer, crisis management, he's also the personal liaison for child safety, and then finally he is certified in child safety seats and the installation of them. So today we're going to talk about child safety seats, and there seems to be always a lot of confusion that goes in how to put these we'll say these apparatuses in our vehicle this time. I think the first thing we want to do is, can we start off just kind of characterizing or classifying what defines an infant versus what defines a young adult?
Sure. Infants are typically classified as those children between 0 and 1 year of age. Mm-hmm. Toddlers are between 2 and 4. 5 to 10 is what you would classify as adolescents. Sure. And then anything above that, like 11 to 14, would be your
more of your young adult.
Right, your young adult, and obviously anything above preteen, teenagers, and all that kind of stuff.
So when we look at the American Pediatrics Association, they have some specific recommendations for infants versus even young adults at this point, where they should be placed and how they should be sitting in the vehicle. Can you explain that and go on to it?
The guidelines have actually just changed recently, as of maybe about 6 months ago or so. Okay. We used to recommend that children stay or ride rear-facing in a rear-facing child seat in your vehicle until at least 1 year and 20 pounds. That has recently changed. Okay. What we recommend now is that they stay rear-facing until at least 2 years of age, or until they reach the upper height and weight limits for the seat itself.
So kind of outgrowing the seat then.
Basically, yes. Okay. Yeah.
So when we even look at going from rear-facing to forward-facing, when does that transition occur?
That would occur, right around 2 years of age, or until they reach the upper height and weight limit for the seat itself. And the reason for that is that it's safer to ride in a vehicle rear-facing than forward-facing.
Yeah, so let's kind of explore that a little bit. What's the difference between a child, going rear-face versus forward-facing, and what's the implications of that?
Well, basically, in every vehicle collision, in every vehicle crash, there's actually 3 separate collisions. Okay. There's the vehicle hitting whatever object it's hitting. Sure. And then what you have is any occupant inside the vehicle is going to have to be stopped by something. Newton's first law of motion. Sure. So whether that be the seatbelt or the dashboard or whatever the case may be, that would be the second collision. And then, of course, anything inside the body, like your internal organs and stuff like that, are going to have to also be stopped by something because they're going to want to continue forward as well. So they'll, hit the rib cage or something like that. So basically, what we found is that if you're rear-facing, the crash forces, since most crashes are frontal, what we found is that anybody sitting rear-facing in a vehicle, the crash forces are actually spread out over a larger area in a child safety seat because it would be spread out over the entire back, the neck area, the head, and stuff like that. And, of course, this is vitally important for infants, especially because they don't have the neck control that you or I do, that adults do. And their heads are, heavier
than the rest of their body,
and larger in comparison than, to adults and stuff like that. So if we can prevent that neck movement, they're better off in a crash.
So the dissipation of forces across a greater area is basically what we're looking to do when we're having a child go rear-facing at this point.
Yep.
So when we look at that and we start to kind of understand more of the physics on that, on how the accidents occur and the forces that go on with that, how does that kind of differ from, we'll say the toddler who's going to go ahead and go we'll say front-facing at this time, and you have less points of contact, so is there typically more injury associated with that then?
There are typically more injuries. What you'll have is, especially with, like I said, the younger children, they're still going to be stopped by the seat. They have the 5-point harness. Most of them are 5-point harnesses nowadays. So they're still going to be, their body is going to be stopped by the harness itself, but their neck is going to want to continue forward. I mean, you see this a lot even in adults, with traffic collisions, stuff like that. You'll see a lot of people with like whiplash injuries and stuff like that because their neck, obviously, I'm sure you see stuff like that. But yeah, I mean, the neck tries to continue forward because the body's stopped, but the neck isn't. There's nothing to restrain it.
But then the chances of a fatality become less because we have, again, forces distributed over 5 points rather than just 1 or 2. Is that correct?
And yes, and what we'll see is typically for children properly restrained in a rear-facing child seat, you're going to see, I think the statistic is about 80% lower fatality rate. So it's pretty significant.
It is significant. So what are some of the common misconceptions that are associated with people wearing seatbelts, not strapping their kids in, that type of stuff? What's going on with that?
A lot of times what we'll see is parents, a lot of times, if they're going on short trips, just going down to the grocery store or something, something small, they feel because they're not going on a large trip, they're not going at higher speeds like on a highway or something like that, they feel a little bit safer, so they might not restrain themselves, they might not use their seatbelt, they might not restrain their child, take as good care as in restraining their child. And unfortunately, that's just not true. I mean, when you look at the statistics, 55% of all major crashes occur near the home in rural settings, like that type of thing. And when you think about it, it kind of makes sense because you make more of those short trips, so the chances are higher that you're going to get into a more serious crash that way than you will on a major highway. The other thing that we see a lot is, everybody's got a story. Oh, well, I know somebody who, if they had been wearing their seatbelt, they would have died because the car went into a lake or something like that, and they wouldn't have been able to get out, or it caught on fire or something like that. And again, these are exceptions to the rule. This is not. This doesn't happen all the time. When you look at the statistics, you're looking at only about 0.5% of all vehicle crashes involve fire or water.
Wow.
So, you're talking 5 out of 1,000. It's not a whole lot.
Well, I thought it was very interesting when we were preparing for this, you and I were talking about, the concept that if you are restrained and you remain conscious, your chances of getting out of a water or a fire episode or situation are much greater. Correct?
Right. And that's just kind of what we were talking about earlier about, the 3 different collisions in a crash. If you're not restrained and you hit, say, the dashboard or the windshield or something like that and get knocked unconscious, not only are you not going to be able to get yourself out of the vehicle, but if you have a child in the car, you're not going to be able to get them out either. So,
so it becomes important to make sure that you're taking care of yourself. Now, this brings us to another concept of when we look at the law versus recommendations and that type of stuff. And again, to me, being on the outside seems confusing. See if you can bring some clarity to it because it doesn't seem like it all kind of adds up.
Right, and it is a little bit confusing, and unfortunately one of the problems with that is that the recommendations from the American Academy of Pediatrics and the law are they're almost saying the same thing, but they're saying it in different terms.
Okay.
The AAP states it in terms of height and weight.
Okay.
And the law does it by age.
All right.
So basically, the recommendations are that, as we kind of talked about earlier, we want infants rear-facing till at least 2 years of age, or until they reach the highest weight and height recommendations for the seat. And then once they reach that upper limit, or 2 years of age, then you can switch them around to a forward-facing child seat with a 5-point harness.
Sure.
Up until they reach the highest weight and height recommendations for that seat.
Okay.
That typically will occur right around 4 years of age, and that's in keeping with the law. The law says that children have to be in some form of approved child safety seat up until 4 years of age.
Right.
Okay, so that would include the rear-facing and then the forward-facing child seat.
Gotcha.
And then once they grow out of the forward-facing child seat, we want children in a booster seat.
Sure.
Until they reach the upper weight limits for that, or they reach 4 foot 9 inches.
Okay.
Okay, because that's typically when seat belts fit correctly in the vehicle.
Okay.
And again, the law states it a little bit differently, but it's kind of along the same lines. The law states that between 4 years of age and 8 years of age, children have to be in a booster seat.
Gotcha.
So they're parallel, but they kind of say it different ways.
Right.
Different ways.
So when can that child move to the glorious front seat? That's the biggest question.
We get this question a lot. The law doesn't specify.
Okay.
Okay. But what we recommend is that children ride in the rear seat for as long as possible, at least up until anybody under 12 years of age, under 13 years of age, we certainly want them in the rear seat.
Gotcha.
And then after that, it's not as